Hi, Miss.
Hey, Stace.
And hello, listeners. Welcome to the Digestible Podcast, where we bring you all the health and wellness information you need in the amount of time that fits into your busy day. And we make it easily digestible. Get it? So, listeners, if you learned something valuable from this episode today, please send it to a friend. It's how we grow and how we get more people the tools to feel better, one pivot at a time. Missy, who is our awesome special guest today?
Well, Stacy, today our special guest is Mark Payares.
Yes, Mark is a physical therapist and he is a self-proclaimed huge digestible fan. He's such a great guy. He's so easy to talk to. He's so knowledgeable. I'm so excited for this conversation.
Yeah, it's going to be great. I love that we talked about both the fact that, okay, as we age, we're supposed to be moving, but sometimes moving hurts. So he's going to talk to us about the normal aches and pains of aging and trying to stay active and how we can do that. And he also talks about, well, I don't know if we're going to take a spin class, if we want to start playing pickleball or tennis or go running, what are the best ways that we can do that and avoid injury at the same time? So it was great. It was a great conversation, and we'll tell you a little bit about him. So Mark holds a clinical doctorate in physical therapy. He has also earned several certifications in coaching in cycling and triathlons, in addition to being a certified bike fitter with the International Bike Fitters Institute. Mark is a Southern California native where he grew up a self-described BMX brat until he was 15 years old. And it was then that Mark discovered road bicycles and started racing bikes for much of his life. In 1989, Mark started competing in multi-sport racing in triathlons. His cycling experience spans from road bikes to mountain bikes to track cycling. He currently is an outpatient physical therapist for a large hospital system. He also has his own private practice where he does custom bike fitting and cycling triathlon and Ironman coaching. So if there's a guy out there, if there's anyone out there that knows how to be an athlete and how to avoid injury and how to stay strong, it is this guy, and he's such a sweetheart.
And here's our conversation. Hey, Mark, welcome to the podcast.
Thanks for having me. I'm excited.
We are so excited to have you today. So you've got all this great experience. Obviously, you're a physical therapist amongst so many other things. Let's start with talking about our aging joints, because I think that's something that's on everyone's mind. So our knees, our shoulders, whether we're super active or not, they all seem to start to act up sometime like in our 40s. Moving forward, why is that? And what can we do to make it stop?
Yeah, it's a great question. And basically you could hit any joint. I mean, from head to toe, right? Just pick one. But knees and shoulders are our big ones. Basically, it's accumulated life, right? What we did or what we didn't do as we were growing up and in our 20s, in our 30s, are starting to show up in our 40s or later. The other thing that contributes to that is genetics. And so if we are predisposed to having some knee issues, well, they're going to show up. And I think as we sit behind computers and stare into monitors and focus on this static posturing, we're not moving. And so they say, motion is lotion for our joints. And so when we don't move, then the joints start reacting and they start responding accordingly.
So what do we do if we sit behind a desk all day?
We have to move. We tell people, physical therapists, or even health and fitness professionals, we tell people move every 20 to 30 minutes. And that can be tough because if they're in a Zoom meeting, if they're locked in a project, if they're giving a presentation, they're going to be there for probably at least an hour, maybe longer. And so that gets tough. So we encourage people to be active throughout their life, through their day as best they can, so that we can have this carryover effect into their daily work lives. So it becomes a challenge, and everyone comes in with a host of different things, whether we've had previous injuries growing up, our tolerances, or our mindsets, which is a whole big can of worms, but all of that can contribute to what we feel and how our body responds.
Okay. Great. So people come in and see you, their shoulder is bothering them, and maybe it came out of nowhere. Maybe they've just been working out and trying to take care of themselves, or their knee. What can just everybody be doing to, other than moving more often? Is there something we can be doing? to help ourselves?
We can seek the advice of healthcare professionals, that's a bit of a loaded answer. And certainly from the physical therapy side, we do see things from a different perspective. So if someone wakes up, and this happens every single day, they wake up, they're like, "Ooh, my shoulder is bothering me." So when we start a new patient, we go through this initial evaluation, and we're getting history. And I think the history is so important because if they're without trauma, so if I didn't fall off my bike and hurt my shoulder, that's a pretty obvious mechanism of injury. If it's not that, a slip and fall, or I played a weekend full of softball or baseball and I threw out my arm, those are obvious. But when someone wakes up and they're like, "That doesn't feel good," and they don't know, we have to look at other sources. And that other source is going to be the neck. And it happens all the time. Someone has a random pain in their shoulder. And so as clinicians, we have to clear other joints that may be contributing. And in this case, it would be the cervical spine. And there are certain tests we can do, certain things we can do to clear that, to rule in or rule out its involvement. So when someone doesn't know, that gets a little difficult unless they have that history where they say, "Oh, I had this shoulder pain, my PT treated my neck," and it's familiar and it comes back and they remember. Maybe they don't have to go seek the advice of a healthcare professional or a doctor, but they say, "Oh, I remember doing these funky turtling exercises with my head and it took my pain away." So unless they have that experience and that recollection of it, then they have to come back. And we sometimes, if we see the same person or they see the same clinician, then they're repeating the same thing. We just have to remind them, and that's okay.
So a lot of shoulder pain starts in the neck.
Sometimes.
I heard that if you sit with your head kind of forward, which a lot of people do, it actually puts a lot more weight on the neck, like a lot more of the burden of weight on your neck, and so that can put a lot of strain on all the muscles and everything.
Yes.
Is that okay? So that's why you do
Yes.
the thing.
So I think with that, I think that's a great observation. And I usually tell people that awareness of that is number one. I tell people, be aware of where your body is at in space.
Okay.
Having that forward head posture, likely cued from what they're staring at, the computer, right? And if their desk ergonomics aren't ideal, then
I find myself doing that a lot. Over looking at my screen.
Yeah.
Okay.
So if you're on a laptop, then we're talking about ergonomics and how to bring the monitor up to eye level. Because if you follow gymnastics or divers or anyone in that realm of athletics, their body follows their head. So wherever they look, their body will follow. Same thing with a monitor. If they're doing this, their whole body is following, right? And they get this forward head posture. They're getting hyperkyphosis through their mid-back or their thoracic spine. And then I tell people, rule number one, gravity always wins. And so the average head weight is 11 pounds. And so once you get the head off this center, gravity's going, "Oh, okay, let's take that head to the ground." Boom, right? And it loads a lot of the tissues. And I think that's what people feel when they feel that heaviness or that muscle strain.
So, that's good information.
It is good. So you mentioned it's kind of normal. You wake up with aches and pains, and we can't always connect it to a trauma or injury. When do we know it's a good time to seek care?
I think 2 weeks is probably 10 to 14 days, right?
Okay.
Depending on its behavior. What I talk a lot about with my patients is pain behavior. If we do something and that pain just goes whoop, it's highly irritable. So after a few days, if that behavior continues, then it's probably time to talk to someone.
Okay.
But if the more we do something, if it goes up and then comes back down, then that's an ideal response. And that could just be normal aging. That's typical of arthritic conditions. The more we move, the better it gets, because arthritis wants to stay stiff, and that stiffness can lead to soreness and or pain. So it goes back to the saying, motion is lotion. Mm-hmm. So the more we move, the better it gets. Until the wheels fall off, and then we start to see other conditions. If someone doesn't have the conditioning, if they go out and run 10 miles and they haven't done that in a while, well, they're going to aggravate things because they don't have the strength. So, yeah, that's where I was going.
Okay, so don't push yourself if you can avoid it, unless you've already been working on those muscles build up. Like a gradual build up is probably a better way than, say, just head first into your 10-mile run. So gradual. And if you have arthritis, because that was going to be my next question, be moving a lot. So, but like, are you saying, so if my wrists or my hands or it's my neck or it's my knees, use them more? Like not strain them or put a lot of pressure on them, but to, like movement is
Yes,
what you're
movement.
suggesting.
And of course, we need to qualify that, right?
Okay.
So having an evaluation from someone to assess the joints, to see what's going on, to get the education, to get the knowledge from from healthcare professionals that have been treating that, getting that knowledge is important because some people take that and they say, oh, okay, I'm going to go out and play 10 hours of tennis, right? That was for you.
Yeah. Yeah. Thanks.
And they strain their wrist because they played too much. So it goes back to your comment of, we need to take it gradually. I thought about this morning because I see this a lot. So, of course, what we see in the clinic, we see a lot of joint replacements, right? Because the joint gets so arthritic, it gets so stiff, gets painful, especially that people go and they elect to have total joint replacements. I think that is a very personal decision for someone to make because pain drives a lot of it. Also, the loss of function can drive a lot of that decision to seek the help of an orthopedic surgeon to have their joint replaced. Now, I've seen people where they decide, or for whatever reason, maybe they have something in their medical history where they don't want to have surgery because maybe they're high risk.
Mm-hmm.
So I've seen this in the clinic and I've seen this in my office where someone's joints are so arthritic, they are so stiff. I saw someone in my bike fit office one time and I watched them get on their bike and I was like, wow, how are they riding their bike? And the stiffness in their joints really showed up in their cycling mechanics. However, they had something in their history where they didn't want to have surgery. They couldn't have surgery because of the risk. So what they did is they decided they were going to work with a personal trainer twice a week, every week, ride their bike, learn, and despite the loss of motion in their joints, hips and knees especially for this person, they had zero pain.
Wow.
So strength training does a lot for someone. And so, what is the magic sauce behind that? So the strength is one thing, but time is another one, right? And I think when we get busy in our lives, when it interrupts function, people's mindsets about what they can't do, what they want to do, starts to affect their decision making. And sometimes they don't give it enough time. And so they go in for the joint replacement.
Mm-hmm.
And hopefully those outcomes are very positive and successful, but sometimes they still struggle. And that's unfortunate. And so it's, these decisions are very personal, but strength training especially. And it was funny because, of course, being a big fan of your podcast, I've listened to every single episode.
Which we appreciate. Thanks, Mark.
Thank you.
What Dr. Mendoza Temple was talking about strength training is so key. It is so important, especially as we age, because we're not moving as much. Again, we're sitting behind computers. We're working in occupations where we're static and we're losing muscle mass. As we age, hormonal changes, our physiologic changes are contributing to this loss of lean muscle mass. And therefore, we're not getting stronger. It doesn't support the joint. It doesn't support function. It doesn't support movement. And then you get this decline of quality of life and function. And people start to freak out a little bit about it.
Right. Well, I'm going to jump in with a question that's unscripted, but
okay.
I understand that your specialty is mechanics, body mechanics, but do you ever bring in the idea of food and diet as far as how it contributes to inflammation or helps tamper down inflammation?
Absolutely. So cycling mechanics, biomechanics are my specialty. But yes, food is so important. Again, you've had other guests on your podcast that have said this, that 80-20, right? Eat clean, eat healthy 80% of the time and give yourself that 20% splurge. It was funny because I think back to my early days of being an athlete. And when I was 19 in my early 20s, and I think this goes for a lot of people, we can rely on our youth to carry us through bad habits. And for me, and that was for me, I was able to perform at such a level, eating garbage really,
Right.
and I was able to perform fairly well. Fast forward now, it's like when we eat clean, when we focus on the nutrition, that fuel, that clean fuel is everything.
Everything.
And in the sport of triathlon, specifically the Ironman distance, a triathlon is swim, bike, run, right? So 3 disciplines. Well, they say that the fourth discipline in triathlon is nutrition, because if you miss your nutrition, your whole day can be shot.
I love that.
That's great.
That is interesting. Okay, I'm going to ask one more question and I'll let Stacey go. And we've brought this up. So I'm curious about this, but also tennis. So the pickleball craze.
Mm-hmm.
I've actually heard things like, oh, there's all these people getting injured now because older people are playing pickleball. But also, I've heard that tennis is a really, really healthy, because it's social and it's very active, very healthy exercise. But I'm worried about all that lateral movement and like knees. Are there some risks that we should be careful of, and what can we do to avoid injury if we want to do these types of activities?
Yes. So again, when we're young, we've come out of hopefully a lot of play, right? And when we play, we are focused on all 3 planes of motion, X, Y, Z, right? Rotation, sagittal plane, frontal plane, so forward movement, horizontal, lateral movement, rotation. As we get older, especially when we go to school, we go to college, we get hyper focused on studies, and we start to sit, right? And so sitting is also a sagittal plane activity, so very forward to back. It's how we move, how we bend. So when we introduce an activity like tennis or pickleball that involves all 3 planes of movement, and when the tissues aren't conditioned or trained to handle those because we've stopped playing or we've stopped exposing our bodies to those movements, then the tissues start to respond. And if we do too much of it, if we're not conditioned, if we don't work on those lateral movements or rotational movements, at some point, and for everyone's this is a little different, then the wheels fall off. And that point is pain, it's dysfunction, it's knee pain, it's Achilles tendonitis. Maybe it's a rolled ankle, or maybe it's a combination thereof. Usually it's one thing. If there's if there's an injury that it was in the history already, it's going to show up in this activity. And when someone really enjoys playing pickleball, because it's a lot of fun, it's very social, they're like, whoo, I'm going to play 4 days of pickleball from 0. They do that for a month, and then all of a sudden they're like, oh, I'm limping. This hurts. And then they come see us. I tell people, I don't want you to do 4 exercises. I want you to do 4 maybe different exercises every other day, right? Because I believe that the body thrives on variety. And so if we do the same thing every other day or every day, we're going to land up in the same boat. And so I want my athletes, I want my patients to build their library into this grand building of exercises. And they're going to pull out different exercises at different times, depending on what level they're at. And if they fall off their schedule based on whatever, maybe it's kids, maybe it's life, maybe it's mindset, whatever, they can go back to floor 1, start there again, and then as they progress, start climbing the floors and start looking at other exercises that challenge them more. And so, yes, there's a simplified answer to that. And that's, can we get them to warm up before playing tennis or pickleball? Yes, there's a dynamic warm up that a lot of the professional players are doing, whether it be baseball or basketball or football. You'll see them on the field doing that. If you get to the field early, they're doing these high knees, butt kicks, karaoke, some shuffling, some squats, some lunging, some exercises to activate their muscles. So doing those things can help, but it still depends on where someone's fundamental strength is. So the long-winded answer to that is, yes, we can do some things to help warm up and hopefully minimize the chances of injury, but I want them to come in with a certain level of strength and capacity to be able to handle 90 minutes, 2 hours of pickleball, because that's what I hear a lot of people doing is they're playing a minimum of 90 minutes and they might be doing it 4 days a week. I have this one patient right now. She loves pickleball. She wants to play, but she's weak. She is so weak. And that's hard for some people when I tell them, take 2 weeks off from pickleball and then go back to it. They're like, oh my gosh, I don't want to lose my pickleball, because it's their social. They have a friend network within that. And to take that away can be a little devastating for some people. So a lot of people want kind of a recipe of exercises. And I'm like, that recipe is going to change. And so that can be very hard for people because it's a little more nebulous.
So we need more variety. Our body needs variety, and no one should just dive headfirst into a sport or activity and just do it all the time. You really have to build up to it.
Yep.
Okay. That makes a lot of sense.
And I think that's the same with food, right? If we eat a lot of the same thing, we're going to miss out on all these other nutrients that our body needs, and it's going to start to affect us in a physiologic way.
Thank you.
Yeah, that's great. Okay, so let's talk a little bit about your private practice and your bike fittings that you do. You train Ironmen, women, triathlons. You train people for cycling, competitive cycling, and not all of us are that level or trying to be that level, but a lot of us use a Peloton or ride our bike or do spin class.
Mm-hmm.
So I will tell you personally, I've taken like 2 or 3 spin classes in my entire life because every time I've taken a spin class, I end up with my back hurting me, which I assume means that I am not fitted to the bike properly. So as a professional who does bike fittings, tell us regular people, how do we fit our bike properly to our body?
Yes. Basically, we want to assess someone in a dynamically static environment, right? So I put a bike on a trainer and I watch them pedal, right? It's not the same. So if we're talking about someone that rides outdoors, that is full dynamic. When I bring someone in, I'm watching them pedal, but in a stationary position. So that is the start, and I start to assess mechanics. And so I start with the movement assessment first, and then based on what they're coming in with in terms of their complaints, then I will pull them off the bike and I will do kind of a brief musculoskeletal exam and start to match their bike position to their current musculoskeletal status. So when it comes to someone's personal bike, we make the changes. The changes stay, they ride their bike, they give me feedback, and if everything's good, then we continue with that. When we talk about Pelotons, spin classes especially, so if someone has a Peloton, we can do a fitting on that Peloton, and that position can stay because it's theirs. When we go into a class situation, well, that bike is used by hundreds of different people. So if there's an opportunity, I can perform a fitting a couple different ways. If it's convenient for me to go somewhere and do the fitting on that machine, I will do that. And then we record that position on that bike. Right? Because usually there's a number or there's a letter or something that can be memorized. And I take a picture and I say, okay, here you go. When you get on this bike, this is where this bike needs to be. And a Peloton, it wasn't really designed for good mechanics. And so there are aftermarket companies that have provided retrofit parts to optimize those. And a lot of people still don't know about it. I know of one guy, he's actually one of the pioneers of bike fitting, who has designed and engineered retrofit parts to go on a Peloton to bring the bars back towards us. The saddles go, they go up and down and forward and backward, but they are kind of designed to be too far back. And so then people are, they're reaching for dear life and they're uncomfortable and then their back hurts, their upper back hurts, their neck hurts, their shoulders hurt. And then you're asked to perform at a pretty high intense level on top of poor mechanics, and then that stresses tissues a lot, and then people have pain and discomfort.
So for us regular people or the listeners out there who aren't going to have the opportunity to work with a professional bike fitter, we get on a bike. When we're pedaling, how straight do we want our knees to get? Like if we're adjusting our seat height, let's start with that.
That's a great question. There are certain norms, and these norms can vary. We don't want it completely straight because that can stress the hamstring. If someone knows they have tight hamstrings, they want to err on the side of lower. To have more of a bend in their knee. That way they don't strain or ultimately injure their hamstring and or their calf, because the calf or the gastroc attaches above the knee. And if they're pointing down a lot, or if they're not pointing down a lot, if they're dropping their heel as they pedal, they can also strain their calf. Being lower is going to be better than being too tall, which can also affect their comfort on the saddle, because saddle is another big one that to each his own, really. So you take one saddle that's designed for hundreds of people, there's probably going to be a good percentage of people that are uncomfortable. Yes. So, not to dive too far off the initial question, but wearing a padded short is going to help to offload pressure and to improve comfort. But in terms of saddle height, in general, pushing that saddle forward as far as you can is going to be good, because that will affect the effective saddle height of the spin bike. So the further forward we go, it will effectively shorten the saddle height. The further back we go, it will lengthen the saddle height. So just push it all the way forward, because again, the way they were designed, you're going to be okay pushing that saddle forward, and we can modify going up and down.
Okay. And I have one question about the pedals. So if we're not like locking in, if we're just using our gym shoes, where best should the pedal go on our foot? Does it go under like the ball of our foot? Like how do we position our foot correctly on that pedal?
That's a great question. Cycling is very much a forefoot dominated activity. So somewhere under the ball of the foot is going to be good as a start. Some people, depending on the shoe wear and maybe something going on with the foot, they can be more towards the midfoot or towards the arch and still be okay. It will impact their saddle height a little bit.
So padded seat forward. Don't have your legs stretch all the way.
Padded shorts, too.
Padded shorts.
Padded shorts.
I said that, didn't I?
You said padded seat. But a padded
shorts.
Yeah.
Padded seat in your shorts.
Some people will, so there is a gel cover for saddles that some people can, it easily goes on and off, and some people can put that on. It provides a nice cushion. The problem with the covers is that they tend to
slide
roll
around. Yeah.
And the same thing with a padded short. Most cyclists that wear a traditional cycling short with a pad or a chamois, we wear bib shorts. Okay. And so I smile and laugh about this a little bit because a lot of cyclists get clowned and they get made fun of a bit for wearing these kind of like pajama shorts, but they do provide a lot of comfort, but they also hold the pad up to the sit area much better. And so when someone wears a cycling short that's not a bib, then that pad can move around a lot more and it can interrupt the pressure disbursement of their sit area, or it may sag. It could cause friction issues. So a bib short is preferable because it will just hold everything in place better.
That's helpful. Thanks.
And for people like us who live in the Midwest where our outdoor season is not year round, and people probably get so excited with the warm weather, they just jump right into anything they can be doing outside and get super active all of a sudden. What advice do you have for like starting off the season strong without injury?
Another great question. If they want to start the season strong, I tell them they need to ride stationary. Well, they need to ride during the winter. And so I pause on that a little bit because, so being a California native, I don't want to get that layered up during the winter. I'm not a fair weathered rider. My floor is about 25 degrees. Like if there's an event and I'm meeting friends, I'm gonna get layered up and I'm gonna go ride in 25 degrees. If we're just training and we want to make it comfortable, I'm gonna set my bike up on a stationary trainer and I'm gonna get into my bib shorts and just a tech tee and a towel and a fan, and I'm gonna spend time riding indoors during the winter. And we don't have to ride the same volume, but I think the consistency of indoor riding during the winter, whether that's on your own bike on a trainer or on a Peloton or some type of spin bike or exercise bike, is going to prepare someone the best for coming out in spring and being very strong and having a good summer season.
Does that carry over into pickleball and tennis and all those things? Like you shouldn't just be like a one season player. Like if you're going to do it, you have to kind of,
yes, you should cross train. You should be working. I tell people everyone should have a trainer because they're going to challenge them to move in different ways to keep them strong, because people want to hibernate in the winter, right? They want to be bears and hibernate and sit and watch Netflix and whatever, and then come out and be like, woohoo, the sun's out and, people are out and they're moving. And too much of one thing can be not so ideal. So working with someone to keep them accountable. And I sometimes chuckle about this too, because it's really not what keeps people accountable during the winter or even all year long is what they're paying. They're accountable to their checkbooks. So if they're paying a trainer, $100 a session, $150 a session, whatever it is, they want to know they're getting the return on their investment. And if they're not, they're going to make a different decision. But because they're spending the money, they want to get the most of their dollar. So hopefully people are motivated by performance and having fun and keeping active, but really it's kind of a year-long thing. And so we have to embrace kind of the cold of winter or the potential dormancy of winter or going inside, but doing something inside consistently is going to be so important to someone's success.
That's great. Okay. So Mark, we like to ask our guests 2 questions. The first one is, what would you like our listeners to take away from today's episode? Maybe an easy action item? Are there some mindset shifts you can recommend to our listeners who want to start making some lasting changes?
It's funny because out of all the questions, it's like these questions kind of like they don't stress me out, but there's so much pressure behind them because it's like, what is
No
what is the
pressure.
takeaway, right? What is the takeaway? I think, and I thought a lot. I've thought a lot about this, and I think it's acceptance of where you're at. And I speak from experience about this. Accept where you're at and move forward. So I believe a lot in mindset. And there's a lot of people that we see in the clinic and that you meet every day that maybe, maybe they're in their 50s or in their 60s and they're like, well, when I was in my 20s, I did XYZ. And well, we're not in our 20s anymore and we can't live in the past. And so we have to accept where we're at and we have to move forward, because if we dwell on that, then we're not going to move forward and we're going to get stuck in this. We can get stuck in our diagnosis or in our pain or in our dysfunction, and we don't move forward. And so accepting where we're at, whether that's aided by someone, if they see as a healthcare professional that can kind of give them the education to help move forward, whoever it may be. Maybe it's a friend that's like, hey man, let's put that all aside. Let's move forward. Let's just do this and let's have fun with it.
I like
Acceptance.
Yeah, acceptance of where you're at. And you can improve, but you're never going to be where you were. So start from where you are. I like
See where
that.
you can go. Yeah.
Yes.
See where you can go. I like that.
Yep.
Okay, here at Digestible, we like to say, don't panic, just pivot. Would you be willing to share a pivot or a small change you've made in your life that's made a big difference?
Again, another one I've thought a lot about because I love the saying. And it's basically, I had a patient a couple of weeks ago that I was working with that I got her to do that same thing. And I'll get to my answer with this real quick, but she was freaking out about what was going on with her body. And I said, okay, let's just bring it all down. Let's see what's going on. And we did some treatment and she felt better. Hopefully they feel better, right? But people tend to, they panic and then they stop doing everything. And so, yes, removing the panic and pivoting is so important. What I've started to do personally to address the question is I've learned to chip away at things. If we look at the whole forest, and that can represent whatever it is, right? I've learned to take one branch off at a time. If I'm trying to clear the forest or if I'm trying to appreciate the forest, I'm looking at one thing at a time. And if you do a little bit each day, it's going to add up to this grand experience that is going to be fulfilling. However that applies to someone, if that's training, doing a little bit each day rather than doing nothing. If we did 10 squats every day, that's going to be more than doing no squats every day, right?
Mm-hmm.
And 10 squats will cost you what? 30 seconds. So I'm trying to do that with where I'm at personally in my life, because I have a 3-year-old and I'm focusing a lot of information or a lot of time and dedication to her. Being a hyper competitive person, I'm either all in or nothing. And so I'm learning to embrace doing little snacks of bike rides or walks or strength training so that it'll all add up to something. So, or as it relates to business, I try and do 1 or 2 small things rather than put them aside, because if we just look at the big picture, we're going to get overwhelmed and we're not going to do anything. So a little long-winded answer, but
that's great.
It is
chip
great.
away.
It's
Chip away.
important.
Chip away
Yes.
because the chips add up.
They do.
The chips add up.
One chip at a time will add to a big
Yeah.
Big
amount
pile.
of yep. Absolutely.
That's great. Mark, thank you so much for being here with us today. This has been wonderful.
Oh my gosh, I feel like I could do this all day.
Yeah, we could. We could talk all day. I could talk to you all day, Mark. You're very easy to talk to.
Yes, thank you,
I
Mark.
appreciate
This has been
that.
really nice.
Yeah, this has been fun. Thank you.
Thank you for listening to the Digestible Podcast with Mark Payares, coach to triathletes and cyclists and physical therapist to all. We hope you enjoyed this episode. And if you did, please share us with others. It's the best compliment you can give us.
We welcome comments and suggestions. Please email us at info@digestiblestrategies.com.
And remember, don't panic, just pivot.
The content shared on this podcast is for informational and entertainment purposes only. We are not medical professionals, and the views expressed here are not intended to diagnose, treat, or cure any health conditions. Always consult with a qualified healthcare provider before making any health-related decisions.